What do MRI and PET scans show for epilepsy surgery? Imagine trying to find a tiny, hidden puzzle piece in a complex picture. That's what doctors do when they look for the source of seizures in the brain. Magnetic resonance imaging, or MRI, and positron emission tomography, or PET scans, are key tools in this search. They help doctors plan surgery for people whose seizures can't be controlled with medication. About 1/3 of people with epilepsy have seizures that medications don't stop, making surgery a possible option. These scans work together to give a clearer picture of what's happening inside the brain. MRI scans are like detailed photographs of the brain's structure. They can spot abnormalities such as scar tissue in the temporal lobe, called mesial temporal sclerosis, or other issues like abnormal growths, cortical dysplasia, or blood vessel problems. These structural clues are important because they point to the exact area causing seizures. But MRI has limits. Sometimes, even in people with hard-to-treat epilepsy, the MRI looks normal. This is called non-lesional epilepsy. Standard MRI machines might miss very small or subtle lesions, especially if they are less than a few millimeters in size. Higher-strength MRI machines, like those with 7 Tesla magnets, can sometimes find lesions that standard machines miss, but they are less common and not always available. That's where PET scans come in. PET imaging measures how the brain uses glucose, which is its main fuel. During the period between seizures, called the interictal phase, the area where seizures originate often shows decreased glucose use, known as hypometabolism. This pattern helps identify the seizure focus even when MRI doesn't reveal any structural abnormality. PET scans have proven very useful, especially in cases where MRI results are unclear. They can help pinpoint the seizure origin in about 80% of patients with normal MRI scans. In children with frontal lobe epilepsy, PET has shown high sensitivity, meaning it's good at detecting true positives. When PET shows hypometabolism on the same side as the seizure focus, it strongly predicts better surgical outcomes, with studies showing an 86% chance of seizure freedom after surgery. Now, combining these two imaging techniques has been a game changer. Hybrid PET and MRI scanners can acquire both images at the same time, providing a more precise picture. This combined approach improves the detection of subtle brain lesions, especially focal cortical dysplasias, which are abnormal areas of brain development that often cause seizures. It also helps doctors see exactly where the abnormal activity is happening by aligning the metabolic data from PET with the detailed anatomy from MRI. This makes it easier to plan surgery and reduces the need for invasive monitoring in some cases. In fact, studies show that hybrid PET MRI can find new lesions in nearly a quarter of patients who initially had no visible abnormalities on MRI alone. It also leads to changes in surgical plans in about 40% of difficult cases, helping surgeons target the right spot more accurately. The impact of these advanced imaging techniques is significant. When MRI and PET findings agree with the electroclinical data, the chances of seizure freedom after surgery can be quite high. Even in cases where MRI looks normal or the results are uncertain, PET and hybrid imaging can identify candidates for surgery who might otherwise be overlooked. This means more people have a chance to live free of seizures through carefully planned surgery. The improved detection of epileptogenic tissue allows for more precise procedures, sometimes even avoiding more invasive tests. It also opens the door for newer, less invasive surgical options. In summary, MRI shows the structural details of the brain, revealing visible lesions that may be causing seizures. PET provides functional information, highlighting areas of abnormal brain activity that might not be visible on MRI. When used together, especially with hybrid PET MRI technology, they offer a powerful way to locate the seizure focus with greater accuracy. This combined imaging approach helps guide surgical decisions, increases the likelihood of success, and offers hope for many with drug-resistant epilepsy. Always remember, each person's brain is unique, so it's essential to work closely with healthcare professionals to determine the best approach for individual cases.